Hello everyone. Today we are going to study a very important topic which is sterilization and disinfection. This topic is not only important for your understanding of this subject or general microbiology, but it is also important for your examinations because this question is frequently asked in long format. There were questions in my university about defining sterilization and various methods of sterilization, along with drawing a diagram of autoclave, writing about its principle and uses. There was also a question about the sterilization in my internal examination, which was differentiating between sterilization and disinfection and explaining the principle and applications of heat based method, which is autoclave. And there was also a concept about CSSD. So I have tried to incorporate all these questions, and also I have tried to add some basic understanding of this topic. So let's start with basic definition of this topic, which is sterilization. Now sterilization means to eliminate all the living microorganism including viable spores, right? Sterilization is the highest form of cleanliness you can attain. This is the highest form, and the agents which are used for sterilization is sterilants. These sterilants are only used on article surface and medium. If you have known if you have went to a hospital, you know there are sterile rooms also. These rooms are heavily purified, the water, the air, everything is controlled. If the person is immunocompromised, that is sterilized. The disinfection is the normal hospital rooms which are disinfected, but sterile rooms are more clean because they don't contain any spores also. Normally we use disinfected area for most hospital environment, but sterilization is used in operation in theater and sterile rooms. Now what is disinfection? Usually people use the definition of sterilization and disinfection interchangeably, but these two are different terms. In disinfection, all the microorganisms are destroyed and removed, all the pathogenic organisms, but not the bacterial spores. In sterilization, the bacterial spores are also eliminated. Disinfection is also used on inanimate objects, not on body surfaces. Both of these are not used on body surfaces. The agents which achieve disinfection are called disinfectants. Now let's start with another definition, which is decontamination. Now decontamination is really simple. We just reduce the pathogenic microbes at a level which the items are considered to be safe to handle without protective attire. Usually we are not using PPE for most hospital equipments. Other than surgical equipment, there are many devices where we don't need to use any PPE. PPE means protective personal equipment. Another definition is asepsis. Asepsis is just a process where the chemical agents are used, like antiseptics, applied on the body surface. This is used on body surface. This is also can be considered to be used on body surface, where the pathogenic microorganisms present on the skin are eliminated. Next is Central Sterile Supply Department, CSSD. This is a very important topic. Now what is CSSD? You see, in a hospital where there are many different departments like medicine, surgery, it is very difficult to keep everything clean. So we need a centralized unit who can oversee the cleanliness of these departments. Usually CSSD is mostly concerned with operating theater, OT. Why it is concerned mostly with OT? Because in an OT a person is present, a patient is present for surgery, and there it is the highest chance of person to get infected. Therefore, we use aseptic procedures for operating theater, and that is handled by CSSD. CSSD has 4 zones and they are unidirectional, and these 4 zones are basically how equipment and consumables are handled and are sterilized. First is decontamination area. In the decontamination area, we just reduce the pathogenic microbe at a level which is easily handled, right? We just see the definition here. Decontamination, this is the process where it happens. This area is where it happens. In decontamination, we use automated machines or just manual wash like ultrasonic washer and washer disinfector. Then there is a packaging area. Now what is packaging area? Here the medical devices are enclosed in materials or container designed to allow the penetration and removal of sterilants during sterilization, and then to protect the device from contamination and other damage following sterilization until the time of use. This area is basically present to keep the unsterilized equipment captured and safe, so it doesn't cause any infections to other people. Then after the sterilization has happened, this packaging area is used for this. The package we have used for the devices are again used for keeping the sterile equipment sterile only. We don't want it to get infected again, right? So this is where they keep it closed and enclosed from surroundings. Then the sterilization area. Here we use different type of sterilizers like steam sterilizer, which is autoclave, ETO sterilizer, or plasma sterilizer. Then there is sterile storage area. Here the sterilized item is kept before they are supplied to OT and other various areas. This sterile storage area is also sterilized, right? We can't keep it in the open. We need to keep it sterile. Now another important topic, which is classification of sterilants and disinfectants. First we start with sterilants. Sterilants allow us to achieve sterilization. We have physical methods, and in this physical method we have heat based method. This was the question that were asked in my examination. What is the heat based method? Here we use a temperature above 100 degrees Celsius. First we have moist heat, which is steam sterilizer and autoclave. You need to understand this autoclave because it is very important topic. Okay, autoclave is very important. Steam sterilizer is the most commonly used sterilization method in hospital. It is used for semi-critical and critical items, right? Very important items like surgical instrument, anesthetic equipment, dental instruments, implanted devices like stents, surgical drapes and linens, culture media, and LS like LJ, LSS, and sputum. Then we also treat the biomedical waste like plastic waste and sharps, and it is also used for killing prions. Now what is control? Now what do you understand by control, right? Control is basically a non-pathogenic way of identifying if the thing which we want to sterilize is sterilized or not. Now Geobacillus stearothermophilus. By thermophilus you can understand it is an archaebacteria which can survive up to 100 degrees Celsius. If these microorganisms cannot grow in an environment, then obviously no other organism will be able to grow, right? Now we come to the parts of autoclave. First is the large cylinder, which is made up of gunmetal and stainless steel, where the things which we want to sterilize are placed. Then comes the steam jacket. It is the water compartment. It consists of a discharge tap, a pressure gauge, and a safety valve. You can see here, this is the diagram. We need to learn this diagram. It's really important, right? We need to learn this. This is the basic parts. You just need to learn this. We have electric heater, which is attached to the jacket and produce steam. This is our place where we keep the things which we want to sterilize, which is the pressure chamber. We have a lid, discharge tap. Here the steam is let out. we have pressure gauge to maintain a particular pressure that we want, and this is the safety valve, and here we have a electric heater. What is the procedure? First, we keep the materials which we want to sterilize inside the cylinder. Then the steam jacket, which is this one, it is filled with sufficient water and lid is closed and the electric heater is turned on. Then the sterilization is divided into three parts. There are three phases. First phase is the conditioning phase. We achieve the steam which we want by turning on the electric heater and turning the water into gas or steam, and we maintain the pressure of 15 pounds per square inch, right? This is the pressure we maintain. After the water is boiling and the steam is achieved, we keep this much amount of pressure, we maintain this pressure. Then we let the materials to be exposed to the steam for 15 minutes in most cases. After that, we have an exhaust phase where the steam is let out, the electric heater is turned off, and we wait till it reaches atmospheric pressure. This is the procedure, the parts and the uses of autoclave, which is the steam sterilizer. This is really easy, but it's really important. We have the second one, which is the dry heat sterilizer, which is the hot air oven. Hot air oven is usually used for glassware, cotton swabs, wax oil, dusting, powders, gel, greasy, paraffin, wax or metallic sharps and non-metallic sharps. Why it is called dry heat? Because there is no steam, there is no humidity. That's why it's called dry heat sterilizer. And we use this method for things which can be affected by steam. Like if we put wax oil, it can be affected, it can be destroyed. Dusting, powders, gel, these all can be destroyed by steam. That's why we use dry heat sterilizer. Now, what is the methods of control? We have physical method, which is thermocouples. It's usually just a small equipment that are kept in hot air oven to see if we have achieved enough temperature or not. We have a chemical method, which is brownish tube. It is also the same as thermocouple only. And we have a biological, which is Clostridium tetani and Bacillus subtilis and Atrophius. These are also non-pathogenic. Clostridium tetani can be said to be pathogenic, but it is not this one. This is the non-pathogenic strain. And here we have the temperature and duration. If you are having 160 degrees Celsius, we need to keep it for 2 hours. If you are having 170 degrees Celsius, we need to keep it for 1 hour. And if you have 180 degrees Celsius, we need to keep it for 30 minutes. Then we have another physical method, which is filtration. Now this is for heat sensitive substances like vaccine, antibiotics, serum and toxins. In filtration, we only have air filters, in which we have two different L filters, which is HEPA, called high efficiency particulate air. This question was asked in my internal examination. The principle is interception, impaction and diffusion. It is very simple. You just need to know what these terms mean. You can just write these terms only and you will get the marks. You don't need to go into full physical details. It's not our concern. We are only concerned with the equipment we are using for achieving sterilization. Then we have for operation theater. It is used for operation theater ICUs, right? You need to have clean air in our ICU and operation theater, right? We use it in laboratories, clean rooms, air purifiers, quarantine wards, everywhere. We have ULPA, which is, or you can say ULPA, which is ultra low particulate air filter. Here we use the control of Berowuniomonas diminuta and Serratia. The name is very difficult, you just need to learn it. Then we have radiation, which is Bacillus pumilus. The control we use, which is Bacillus pumilus. And in radiation we also have two parts, which is ionizing radiation and non-ionizing radiation. The ionizing radiation is cold. It does not increase the temperature of the particular substance we are using. It has high penetrating power and it is sporicidal. Sporicidal means it kills the spores. We have the example of X-ray, gamma ray and cosmic ray. And in low penetrating power we have non-ionizing radiation, which is infrared ray. Then we have others, which are incinerators and microwaves. Incinerator is usually to destroy any hospital waste like anatomical waste, human anatomical waste, animal carcasses, soil bedding dressings, we just need to destroy it. We don't need to reuse, recycle it, so we just need to destroy it. Therefore we use incinerators. And microwave is also there. You know what microwave is. I don't need to explain it. Then chemical methods. We have ethylene oxide sterilizer. It is a gas sterilizer. It is basically steam sterilizer. We just replace the water with gas, which is the ETO. It is used in cardiopulmonary machine. It has pre-packaged syringe, or sorry, we use it for pre-packaged syringe, and the control is Bacillus globigi. Then we have plasma sterilizer, which is also known as Sterard. You need to know this term. It's really important. You need to know this term. Okay. We have in plasma sterilizer, we use UV photons, and we use it for arthroscopes and urethroskopes. And the control is Bacillus stearothermophilus. Then we have disinfectants, right? In disinfectants, we have different levels of disinfectants. First, we have high level. In high level, there are no physical methods. We only have chemical methods, in which we have used aldehyde, glutaraldehyde, orthophthaldehyde, formaldehyde, and peracetic acid and hydrogen peroxide. In intermediate level, we have physical methods, which is in heat based. We have two different parts, which is one lower than 100 degrees Celsius, which is pasteurization, incipation. Incipation we use for culture media that are not being treated by autoclave. All culture media are treated by autoclave, apart from some which are instead they are done incipation or tinderization. These two methods we use for some different culture media. And at the 100 degrees Celsius we use boiling, steaming and tinderization. Then we have radiation, in which we use non-ionizing. Yet we have non-ionizing in sterilization also, where we use infrared ray. But in non-ionizing, for disinfection we use ultraviolet ray. It is only bactericidal, obviously. If it has low penetrating power, it will be only bactericidal. Or disinfection is only bactericidal. It is not for sporicidal. Then we have chemical methods, in which we have alcohol, which is ethyl alcohol and isopropyl alcohol. We have phenolics like phenol, cresol, lysol, and halogens like iodine and chlorine. Then we have low level of disinfection, in which we only have chemical methods, which are quaternary ammonium compound, which we use in soaps, right? If you have studied class 12 chemistry, you know we use these type of salts for soaps, and chlorhexidine. Then there is cleaning. Cleaning is basically the decontamination we use, in which we use ultrasonic washers, washer disinfectors and automated card washers. And we have chemical methods, in which enzymatic solution, detergent, soap and CSSD methods are used. Then obviously these parts are very difficult to learn and very difficult to remember, right? If you just understand all this for once, you can use these flowcharts to revise. We have sterilants, right, in which we have physical methods. Heat based, which is moist heat, which is autoclave. You know what autoclave is. More than 100 degrees Celsius. What are the control we use? What are the procedures, uses, diagram? All this we need to know. Then the uses of hot air oven, also the uses of HEPA, ULPA, radiation. Which one is cold? Which one is hot? Which one has high penetrating power? Which has low penetrating power? Then the incinerators. What are the uses of incinerators? In the chemical, we have ethylene oxide and plasma sterilizer. This is the flowchart for disinfections. This is chemical methods, right? This all we have peracetic acid, hydrogen peroxide. Then we have intermediate. In chemical, we have alcohol, ethanol, isopropyl alcohol, phenolics, halogen. We have physical methods also: heat based, more less than 100 degrees Celsius, pasteurization, incipation, which culture media are done with incipation. We have at 100 degree boiling, steaming, tinderization, which is used for culture media. We need to know what culture media is. You can study this in the next video I'm going to make, hopefully in the future, about culture media also. I will tell you about the different culture media which are done with tinderization. And then we have radiation, where we use ultraviolet rays. And the low level, obviously we know the level, what low level we use, which is quaternary ammonium compound and chlorhexidine, right? This whole topic is really important. You need to know this. Hopefully you can make short notes from this video, and hopefully you have understood what sterilization disinfection is. I hope you have a Good day. Bye.